Hello and welcome to today's Here's to Your Health podcast. I'm Don Lintzman, your host, and my guest on the podcast today is Connie Riesselman. Connie is the SHIIP coordinator here at Crawford County Memorial Hospital. SHIIP stands for the Senior Health Insurance and Information Program. And Connie's been with us for a couple of years. And Connie, thank you for joining me today.
Yes, I'm happy to be here, Don. Thanks for asking me to be a part of this program.
Is it really 4 years already?
It is.
4 years.
I'm on my fourth year.
Oh my gosh. I need to pay more attention. Of course, when I was young, I was so poor I couldn't pay attention. So,
jeez.
Well, we're going to talk today about open enrollment, which is coming up, and this is for people who are on Medicare.
Correct.
People like me. You'd be so proud of me, Connie.
Are you on it now?
I came to the Welcome to Medicare seminar a year ago.
Yes.
And I actually went online and filled out all of my stuff, and I got my Medicare card in the mail earlier this week. I cannot tell you how proud I am to have graduated to the senior citizen level, the official geezer stage of my life.
There you go. Welcome aboard. And did you learn anything from the Welcome to Medicare seminar?
I did, as a matter of fact. We're going to talk about that.
Yeah.
I know we won't have another one until next year, but I think Welcome to Medicare is so important to really understand how this works, and I do think that information is invaluable.
Yes, it is. And I'll probably be having another seminar in March.
Yes.
I do 3 a year usually.
Yeah. So we'll have that coming up. Let's talk a little bit about open enrollment. Because this is coming up beginning on October 15th and it runs through December 7th. So in just a couple of weeks, people who are on Medicare will have an opportunity to do a couple of different kinds of things. But let's talk about, when open enrollment starts, what sorts of information or what sorts of decisions will people on Medicare have to start making?
So first off, the people who have been to my office previously, a couple of weeks ago, Barb and I got together letters and forms to fill out.
And that's Barb Russer.
Yeah, and she's a counselor also. And we sent out letters to all of our previous clients asking them to complete the forms and submit them back in. And it's mainly updated information. And then the second sheet is a list of the prescription medications. And then we will enter all their prescription medications. We'll update that into the Medicare.gov system for each of them before October 15th, so that all their updated current drugs are in the Medicare.gov system. After October 15th comes, then we can go look at the new plans to see if their current plan is the best plan or if a better plan is out there for them this year.
And you're talking about Medicare Part D.
Part D, the drug plan. Right. That's what open enrollment is for, that and Medicare Advantage.
Yeah.
But yeah, this is Part D or Advantage, either one, because Advantage plans carry your drug plan.
Right.
So either way, we're going to update the drug plan or the drugs that their prescriptions are for on Medicare.gov, and then we're going to look at the plans, either Part D or Medicare Advantage, either one. And then we're going to let the people know if they need to have a visit with us and come into the office, or if they should stay with the same plan. However, this coming year, we're going to see some changes in other things. One of them being, used to be the catastrophic level, which means after you pay out of your pocket, the drug plan pays, and then you pay a copay. Once you paid $8,000 a year out of your pocket, all your drugs were free. That's catastrophic. They've changed that for 2025, down from $8,000 to $2,000. So people who are on expensive medications may hit that $2,000 mark, and there are new options for them. So it's important for people to know coming up, catastrophic went from $8,000 to $2,000. That's after you paid $2,000 out of your pocket, everything will be paid. And there's a new option for payment if you fall in that category. So that's something new we're going to be talking to people about this year.
My guest on the podcast today is Connie Riesselman. Connie is our SHIIP coordinator here at CCMH. We're talking about Medicare Open Enrollment, which is coming up beginning on October 15th. Connie, having said that, I do know there's always been questions about drug coverages, especially for seniors. There's some really expensive drugs out there, and we know that not every drug is covered under every formulary.
Right. A formulary is a drug. Not every formulary or drug is covered under every plan.
Okay.
So we check that, yes. We
Yeah,
make sure
so thank you for verifying
every
that.
drug,
Yeah.
we make sure every drug is covered under the plan.
Yeah, but my question is, for those people who are on medications that are not necessarily covered, what kinds of options do
Or
they have?
if they're really expensive.
Or very expensive.
Okay, so one option is everybody's heard of Good RX. They advertise it on TV, and you always think, oh, is this a scam? What's going on? No, it is good. It is a coupon company. And all your pharmacists know about these coupon companies. Good RX is probably the best known. So if the doctor is going to prescribe medication for me that costs $450, and I go to the pharmacy and it's like, okay, your bill's $450. You go, oh, gasp. You can say, does my drug plan cover that? And they can say no if it doesn't. And you can say, try a coupon, try Good RX and see if it would cost less through them. Those coupons are real, and ask your pharmacy about them. Sometimes your drug plan covers them, but if you have a deductible of $590, after that you pay that $590 deductible, then it goes down to like $42 a month. So that's things we look at every time you come in.
You know, this always is interesting to me, because whenever you deal with government programs, things change, they're different. Parameters are, from one year to the next can change dramatically, which is what we're talking about with Medicare Part D. Maybe you can give the people who are listening today some insight, especially for people like me. Now, I have not signed up. I'm still on group health insurance, so I'm not on Medicare Part B, and I don't have Part D. But I know that those days are coming for me, and it won't be that much longer. Next year, I'll be in your office looking at these things, because I will be in the process of retiring, and I will need to have all of this stuff taken care of. But maybe you can share with people. I know we don't sell the Medicare. We don't sell any plans. So people still have to have their own agent who takes care of those things for them. But the question that I want to ask is, what's the actual, what's the cost of some of these plans? I mean, there's not really maybe like an average cost, but kind of a range. I mean, an idea of what something like that might run?
Okay, so I'm kind of getting from you maybe two different things.
Okay, let's talk about two different things.
The Part D drug plan is, you don't really have to have an agent for that.
Okay.
They're all listed on Medicare.gov, and that's the system we use here.
Okay.
So we will log you in. A lot of my clients already have an account. We log into Medicare.gov. Every Part D drug plan that is offered in Iowa, in our area, is on that plan, and it does an automatic comparison based on the drugs you enter as to what would be the best plan for that person. And we can enroll you right on Medicare.gov for that plan.
Oh, cool.
We don't
Excellent.
need an agent.
Okay. That sounds great.
What you need an agent for is if you're staying with Original Medicare and getting a supplement and a Part D plan.
Okay.
You will need an agent for your supplement plan.
Okay.
But we can show you all the supplement plans offered in Iowa and what it might cost you.
One more good reason for people to come see you, Connie.
Yep.
One more good reason.
Yep. Because you can go to an independent or insurance agent, but they might only offer 4 or 5 different supplement plans. Mm-hmm. I can show you every plan that's available in the state of Iowa.
So
can't sell it to you,
Yeah.
can't sign you up for it, but I can show you what's out there.
But an idea of cost. I mean,
idea of cost.
Can you give us some kind of a range?
For the drug plan this year, I
Yeah.
can tell you what the average is this year. I don't know what's coming up next year until after
Okay.
October 15th. This year, 50 cents a month. I think the highest one is $123 a month.
Wow.
And you're going, why would you pick $123 if you can get it for 50 cents? Because if you're on all those expensive drugs, they might make you pay more for the premium, but you might only pay $20 for the drug instead of $200. So it sorts that all out for you.
Yeah. It
It's
kind of,
based-
one way or the other, right? You're going to end up paying your costs, whatever that might end up happening to
Right.
be.
So it just depends.
Very interesting.
Yeah.
Very interesting. I know we have people who are listening today who probably have a ton of questions. Maybe some people like me who are just recent enrollees. Maybe they haven't been to a Welcome to Medicare seminar. And I'm gonna kind of cut to the chase here, and we'll reiterate this at the end because I think I've got at least one or two more questions before we get there. But to give everybody kind of a sneak preview, they need to come, if they really want to come visit with you, they're going to have to make an appointment. I mean, because you do see a significant number of people every
Yes.
given year.
Yes. Between October 15th and December 7th, either Barb or someone will be in the office every day, I would guess. Normal hours.
And
But in the off season, from December 7th till October 15th, you'll see that we're not in the office here at the hospital, but we are available. We're available every day of the year. So you call the number that's listed as the SHIIP number, and the information, people at the information desk take that information and they email me or Barb and say, Don Linsman at this phone number would like for you to call them. They have a question about Medicare. So then we call them from home and either set up an appointment or answer their questions. So we're busy all year long.
my guest on the podcast today is Connie Riesselman. Connie is the SHIIP coordinator here at CCMH. She's assisted by Barb Resser. And Barb's not here today, but I know that she's also very good at doing these kinds of things. Maybe one last question today. We talked about all of the people that you help with Medicare, especially with Part D. I know that every year we have an opportunity to see a lot of people, but we also help them save some money in the process.
Yes, because I have had people who just learned about the SHIIP office and have come to me, and they've had Medicare for maybe 10 years and they have never changed their drug plan. They didn't know they could change their drug plan. I had a couple years ago who had the same, in their 70s, had the same drug plan from when they turned 65. They were going to a pharmacy that didn't accept their drug plan, and they were paying the full costs for all of their prescription drugs and didn't know it. And so then I got them in a plan starting the next year that would save them money. They had to change pharmacies. Don't fall in love with your pharmacy, by the way, because it makes a difference.
It sure does, absolutely.
Different pharmacies have different plans and have different prices. So it sounds crazy, but I saved that couple $12,000 a year.
Wow. Wow.
By changing pharmacy and changing drug plan.
Man. That makes some sense. I mean, I think...
Now, average, you save people $100 to $300 a year, maybe. Maybe only $50 a year. It just depends. And then it's always the person's choice if they want to change plans. I show them the information. It's up to them whether they want to change plans or change pharmacies. But I give them the details of what it could be if they changed.
Well, and I realize that everybody's probably on a fixed income, but especially true when you get past 65 or 66 or whatever that number is, when you finally quit working and that regular paycheck is not coming in. Any kind of money that anybody can save on any of those kinds of things, I think would certainly be welcome. One last word today, Connie, before we go. If you were going to make any sort of, give any advice or make any sort of recommendation to people who are on Medicare and maybe have never come to see anybody from SHIIP, or maybe they didn't even realize, like the couple that you're talking about, maybe they didn't realize that they could change their drug plan. What sort of advice would you give them about open enrollment that's coming up here in just a couple of weeks? What should they be doing?
They should be calling our office to set up an appointment to see what can happen, to see if they're on the right drug plan or not. The people who have come to our office, I would ask that they spread the word. Most of the people we see come to see us and know about us by word of mouth.
So maybe that's the last word today, and that's our final takeaway. And I appreciate your time.
Spread the word.
Yeah, we want people to be able to come in, sign up for Medicare, and get the best possible drug plan that they can get. And I appreciate your time today, Connie. Thank you very much. My guest on the podcast today is Connie Riesselman. Connie is the SHIIP coordinator here at CCMH. We're talking about open enrollment, which begins on October 15th. And for anybody who is on Medicare, especially on Part D, we encourage to contact the hospital and get an appointment before December 7th so that we can help you review your drug plan and potentially save you a little bit of money. I'm Don Lintzman, your host for the Here's to Your Health podcast. Thank you for joining us today. Have a great day.